Cataract surgery is a procedure used to remove the cloudy lens that blurs vision. And here's exactly what happens during it. After the eye is numbed with special drops, the surgeon creates a tiny incision at the edge of the cornea and inserts a small ultrasound probe that gently breaks the cloudy lens into tiny pieces. Those pieces are then carefully suctioned out, leaving the clear lens capsule in place. Through the same small opening, a folded artificial lens, called an intraocular lens or IOL, is slipped inside the eye, where it unfolds perfectly into position to replace the old cloudy lens. Because the incision is so small, it seals naturally without stitches, and the whole procedure typically takes just 10 to 15 minutes. Vision starts improving soon after, with colors appearing brighter and details clearer as the eye heals. Cataract surgery is fast, precise, and one of the most effective ways to restore sharp, clear sight. Follow for more clear and engaging medical explainers.